Happy New Year from NAAOP. This is Peter Thomas in Washington, D.C., NAAOP General Counsel. We wanted to begin by looking back at the end of December and talking about the prior authorization final rule, which CMS issued late in December 30th. Ultimately, the rule is a culmination of a lot of work that NAAOP and the O&P Alliance pursued in 2014 by submitting extensive comments to the proposed rule on prior authorization, as well as worked throughout 2015 to try to get the best rule possible, knowing that CMS was intent on publishing a final regulation on this issue. The final rule came out. There are some victories, and there are some, unfortunately, they didn't adopt a number of our views. It's a mixed bag. And so we are pleased that the final rule essentially would permit some protection from auditing for prosthetic claims that are subject to prior authorization and that have received an affirmative authorized decision. There are some exceptions for fraud and for circumstances where cert audits will occur, because that's required by federal law. But ultimately, there is some protection from additional auditing once a prior authorization request has been approved by CMS and its contractors. That's really good news, and it's a concession by the government that was not included in the proposed rule. There will also be an ability for CMS and its contractors to roll out prior authorization on a more gradual basis than was suggested in the proposed rule. They'll be able to identify certain items on the DMEPOS fee schedule master list, which applies to prior authorization, and not necessarily every item on the master list, but select those items that it intends to move forward with prior authorization on a regional basis. They won't have to do it nationally, and they won't necessarily impose prior authorization on every item that's on the master list. There are 84 codes that have been identified under the prostheses benefit. Currently, there are no orthotic codes that are exposed to prior authorization in the coming year, but the master list can be updated automatically and annually, and virtually any billing code, any item of DMEPOS that is identified in a government report, the General Accounting Office, the Inspector General's Office, or in a cert report that exceeds a $1,000 threshold can be subject to prior authorization and will be automatically added to the master list in future years. So this is a significant rule that CMS has promulgated. It gives CMS another tool to fight what they believe would be perceived kind of overutilization of certain codes, identified in the way and the manner that I just recounted. And it will be a challenge to the O&P field to figure out exactly how prior authorization is going to impact the services provided by prosthetists across the country. Again, orthotists being spared, at least for the near term. We look forward to working with CMS to try to issue sub-regulatory guidance. They intend to do so in the near term to relate to providers how to go about submitting prior authorization requests. And we look forward to working with our members and the rest of the O&P field to make sure that people understand how to submit these requests, and if there are problems, that we raise them with CMS and try to resolve them as expeditiously as possible. Next report will focus on what should occur in 2016. It's a major election year. It seems that there's a new bipartisan spirit in Congress. There's a lot on Congress's plate and a lot on the agenda of the Department of Health and Human Services that we will preview and discuss in future video. Thanks so much. Have a great January.